Hello friends, today I am going to reveal some true facts of stomach cancer treatment. But first of all, I request you to please share and subscribe the channel for getting my informative true facts videos uninterrupted. Please note that subscription of my channel is free of cost. Now, stomach cancer treatment. Treatment of stomach cancer depends to a large degree on where the cancer started in the stomach and how far it has spread. Stomach cancers can grow and spread in different ways. They can grow through the walls of the stomach and invade nearby organs. They can also spread to the lymph vessel and nearby lymph nodes. Be inside a structure that help fight infections, that is lymph nodes. The stomach has a very rich network of lymph vessels and nodes. As the stomach cancer becomes more advanced, it can travel through the bloodstream and spread to organs such as the liver, lungs and bones, which can make it harder to treat. Now stage 0. Because stage 0 cancers are limited to the inner lining layer of the stomach and have not grown into deeper layers. They can be treated by surgery alone, no chemotherapy or radiation thereby needed. Surgery with either subtotal gastrectomy, removal of the part of the stomach, or total gastrectomy, removal of the entire stomach is often the main treatment for these cancers. Nearby lymph nodes are removed as well. Some small stage 0 cancer can be treated by endoscopic resection. In this procedure, the cancer is removed through an endoscope passed down the throat. This is done more often in Japan, where stomach cancer is often detected early during screening. It is rare to find stomach cancer so early in the other states, other countries. So this treatment has not been used as much here. If it is done, it should be at cancer center that has a great deal of experience with this technique. Now stage 1. Stage 1A. People with stage 1A stomach cancer typically have their cancer removed by total or subtotal gastrectomy. The nearby lymph nodes are also removed. Endoscopic dissections may rarely by option for a small T1A cancers. No other treatment is usually needed after surgery. Stage 1B. The main treatment for this stage of stomach cancer is surgery, total or subtotal gastrectomy, chemotherapy, chemo or chemoradiation, chemo plus radiation therapy may be given before surgery to try to shrink the cancer and make it easier to remove. After surgery, patients whose lymph nodes removed at surgery show no signs of cancer is sometimes observed without further treatment, but often doctors will recommend treatment with either chemoradiation or chemo alone after surgery, especially if the patient didn't get one of these before surgery. Patients who were treated with chemo before surgery may get the same chemo without radiation after surgery. If cancer is found in the lymph node, treatment with either chemoradiation, chemo alone, or a combination of the two is often recommended. If a person is too sick from other illnesses also to have surgery, they may be treated with chemoradiation. If they can tolerate, other options include radiation therapy or chemo alone. Stage 2 cancer, stage 2. The main treatment to stage 2 stomach cancer is surgery to remove all or part of the stomach, the omentum and nearby lymph nodes. Many patients are treated with chemo or chemo radiation before surgery to try to shrink the cancer and make it easier to remove. Treatment after surgery may include chemo alone or chemo radiation. If a person is too sick from other illness also to have surgery, they may be treated with chemo radiation. If they can tolerate it, other options include radiation therapy or chemo alone. Now stage 3. Surgery is the main treatment for patients with this stage disease, unless they have other medical conditions that make them too ill for it. Some patients may be cured by surgery alone, along with other treatments. While for others, the surgery may be able to help control the cancer or help relieve symptoms. Some people may get chemo or chemo radiation before surgery to try shrink the cancer and make it easier to remove. Patients who get chemo before surgery will probably get chemo after as well. For patients who don't get chemo before surgery and for those who have surgery but have some cancers left behind, treatment after surgery is usually chemo radiation. If a person is too sick from other illnesses to have surgery, they may be treated with chemo radiation. If they can tolerate it, other options include radiation therapy or chemo alone. Stage 4 cancer. Because stage 4 stomach cancer has spread to distant organs, a cure is usually not possible. But treatment can often help keep the cancer under control and help relieve symptoms. This might include surgery, such as gastric bypass or even a subtotal gastrectomy in some cases, to keep the stomach and or intestine from becoming blocked, obstructed, or to be controlled bleeding. In some cases, a laser beam lighted through an endoscope, a long flexible tube passed down the throat, can destroy most of the tumor and relieve obstructions without surgery. If needed, a stent, a hollow metal tube, may be placed where the esophagus and stomach meet to help keep it open and allow food to pass through it. This can also be done at the junction of the stomach and at the small intestine. Chemo and or radiation therapy can often help shrink the cancer and relieve some symptoms, as well as help patients live longer, but is usually not expected to cure the cancer. Combination of chemo drugs are most commonly used, but with the combination is best is not clear. Targeted therapy. Targeted therapy can also be helpful in treating advanced stomach cancers. Herceptin can be added to chemotherapy for patients whose tumors are HER2 positive. Ramucirumab may also be the option at some point. It can be given by itself or added to chemo. Immunotherapy drug might also be an option at some point. Because these cancers can be hard to treat, new treatment being tested in clinical trial may benefit some patients. Even if the treatment do not destroy or shrink the cancer, there are always be to relieve pain and symptoms from the disease. Patients should tell their cancer care team about any symptoms or pain they have right away, so they can manage it effectively. Nutrition is another concern for many patients with stomach cancer. Help is available, ranging from nutritional counseling, replacement of tube and small intestine to help provide nutrition for those who have trouble eating if needed. Recurrent cancer. Cancer that comes back after initial treatment, known as recurrent cancer. Treatment options for recurrent disease are generally the same as they are for stage 4 cancers. But they also depends on where the cancer recurs, what treatment a person has already had and the person's general health. In my next video, I will reveal the true facts of other most interesting topics. Thanks.